Student Nursing Associate programme was developed to bridge the gap between healthcare assistants and registered nurses, ensuring that you have professionals that are accountable to the Nursing and Midwifery Council.
So within our organisation, we think it's an excellent opportunity for our bands to be able to develop and be registrants with the NMC at the end of their 2-year programme.
So I used to be a carer, but then I was moved into the NHS and I was given the opportunity to become a student nursing associate by my trust, and they've offered to second me. So obviously I was really excited about that in order to broaden my horizons, shall we say.
What experience I had prior to my career is I've been a carer for like 6-7 years now, and I said to myself, I think I can do more than what I'm giving now. So that's why when this opportunity opened up, I didn't hesitate to get into this apprenticeship program. I chose this nursing apprenticeship because I know that there is a stepping stone to go on, or to go a higher level, and I think doing this is really a good opportunity for me to become a nurse one day.
So the impact that the Registered Nursing Associate has on our workforce, it enables them to be at the bedside with the patient to provide excellent patient care, and also to support the registered nurse. Also they have that career development in relation to their career after qualifying to be able to be a registered nurse.
As part of the apprenticeship, learners will be upskilled to meet current workforce demands, which is important in today's times within the NHS.
So ultimately, obviously, I'm going to qualify as a registered nursing associate. However, after a year or so, I do wish to go and do the nursing top-up, because ideally I'd like to work in a surgical setting.
So I'm seeing myself in a few years' time to be a registered nurse, because I want to do not just the bedside, but to deal with more complex clinical skills with regard to patients' care.
The programme is accredited by the Nursing and Midwifery Council and the Standards for Professionals for Apprenticeships for Nursing Associates. The programme is a 2-year foundation degree delivered by experienced and diverse academic and support staff, working in line with a teaching and learning strategy that fosters development through contemporary modules to support achievement.
There's a lot of support for our student nursing associates out in practice. First and foremost, there will be the staff within the hospital themselves, but ultimately it will be the staff here at the University of Chester who provide that support also in terms of academic support if they do struggle with, assessments, etc. So ultimately, our aim is to get the students through the programme and to achieve their goal.
Doing this course has really helped me to be better with regards to looking after a patient. I'm able to recognize patients' deteriorations by learning different skills through my theory and my practical experience.
The programme is highly evaluated by students through our National Student Survey results, and ranking at 90% or above across every area of the programme, in conjunction with a recent Ofsted inspection where the programme as part of the university was ranked as good.
We have good working relationships with the University of Chester. We started the programme back in 2017. It was a joint partnership and joint partnership working as well. So we developed the programme together. We do encourage good working relationships with the team, and I can honestly say that is in place. We communicate on a daily basis with our colleagues over at the university, and that ensures that the students are fully aware of that partnership working as well.
We deliver the curriculum across Warrington and Chester campuses to ensure that we meet the needs of our local employers throughout Cheshire and Merseyside. The apprenticeship model means that students remain in employment and attend university 1 day per week. For employers, this means that your students remain in clinical practice and have the opportunity to attend 3 spoke placements per year, getting a variety of experience across learning disabilities, mental health, adult and child fields. This includes working in hospital, community and independent sectors, along with accessing our state-of-the-art simulation suites which emulate first-hand experience.
I really enjoy doing this apprenticeship because I go to different places like the learning disability, the adult, child, and I've gained different skills and different experiences, which is really beneficial for doing this kind of a training.
I've definitely realised more about how important empathy and compassion are, not just towards patients, but also towards colleagues, and also, you know, branching out to family and friends as well. I've actually really loved getting to meet a new group of people, all really like-minded people, and I've also loved doing the different placements, and also, as I previously said, you know, just expanding my knowledge essentially. It's all just really exciting.
Students gain experience from using patient simulators and virtual reality technology that will fully immerse them into that live patient experience and enhance their skill set. The apprenticeship is funded by employers via a levy. Learners will need to be in employment for 30 hours per week and attend university 1 day per week. On completion of the programme, Nursing Associates will finish with a foundation degree, and they will then be eligible to apply to the Nursing and Midwifery Council as a registered Nursing Associate, and then they'll be in a perfect position to kickstart their future careers.